Hi everyone, my name is Jennifer and I am a medical student at Georgetown University in Washington, D.C., working with the Burn and Surgical Research Lab at MedStar Health. And thank you for giving me the opportunity to present our research today. So, as you may know, burn patients often experience severe pain and itch caused by hypertrophic scars, and these severe sensory symptoms significantly impact quality of life. Laser treatment improves these symptoms in some patients, but not in all patients, and the reasons for this discrepancy need to be better understood. Categorizing patients by sex allows us to assess whether sex differences play a role in variations in itch-related outcomes. Studies suggest that estrogen suppresses acute and chronic itch in mice, but estradiol, which is a potent form of estrogen, enhances histamine-evoked itch in female mice. Therefore, our study aims to assess if female patients who typically have higher estrogen levels would have fewer itch-related improvements compared to their male counterparts. So we hypothesize that female patients would rate their scars higher on itch scales than male patients throughout a course of laser treatment for scars. At our institution, patients received fractional ablative CO2 laser at 4 to 8 week intervals, and their scars were evaluated by a burn therapist using the Patient and Observer Scar Assessment Scale, called the POSIS, preoperatively and at 3 post-op follow-ups, 1 to 2 weeks after each treatment. A total of 125 patients were included in this retrospective chart review, and patients were categorized by birth sex as noted in their charts into two groups, consisting of 62 patients assigned female at birth and 63 patients assigned male at birth. We then compared demographic and scar characteristic variables between the two groups. Patients' ratings of itch were evaluated using the patient portion of the POSIS. We found that there were no statistically significant differences between both groups in the following demographics and scar injury characteristics, which then allowed us to attribute any differences we saw in itch outcomes to birth sex alone. So on the itch portion of the POSIS, a score of 1 indicated no pruritus, and a score of 10 indicated that the scar was extremely pruritic. So a higher score indicates a worse outcome. So in the pre-op evaluations, there was a statistically significant difference in itch score between female and male patients, but there were no significant differences in itch scores between both groups in the first, second, or third post-op evaluations. Within the female patients, on the right chart over there were significant differences in itch scores after the second and third post-op, where the score decreased from a mean of 6.5 at pre-op to 5.3 and 4.8. Within the male patients, there was a statistically significant difference between the pre-op and third post-op itch scores, which decreased from 5.1 to 4.1. So overall, both groups did improve in patient-reported itch outcomes by the third post-op evaluation, and female patients did initially rate their scar itch higher at pre-op than male patients did. But again, there were no differences between both groups in itch ratings at post-op evaluations. A significant decrease in itch score in female patients after the second post-op suggests that female patients improved in itch faster than male patients did, since male patients only improved to a significant decrease after the third post-op follow-up. Additionally, the difference in female itch scores from pre-op to the third post-op was 1.7, whereas the difference in male itch scores was 1.0, suggesting that female patients also improved to a more significant degree in itch than male patients did. So one possible explanation for these results is that there may be a gender-based biological component, such as estrogen, that rapidly and significantly improves scar itching. Notably, a decrease in estrogen during menopause is often associated with cirrhosis, which is abnormally dry skin, and that is frequently accompanied by increased itching. So this association suggests that estrogen may improve itching by increasing the skin moisture, which may account for these results. A future study could consider whether these patients are taking hormones or hormone blockers to see if there is a correlation with serum estrogen levels. A measurable difference between female and male patients regarding patient-reported itch outcomes would mean that gender differences may need to be considered to represent the true range of itch-related outcomes, even for validated scar metrics. Thank you.